In New Orleans' Central City neighborhood, grief lives on every block. Loved ones lost to COVID-19.
Did you ever imagine that you would have lost 3 family members to the same virus?
No, not at all.
Stephen Elawa's uncle, cousin, and mother died in just 11 days.
Just be thankful that, that you're able to see your mom, to see your uncle, because, at the end of the day, all I have is memories.
Communities like Central City are suffering the worst impact of the virus. African Americans are 4 times more likely to be hospitalized, according to federal data. In Louisiana, more than 75% of patients hospitalized and more than 70% of those who died were Black, when they make up just 31% of the population. Councilman Jay Banks says the disparity is obvious between Central City and the neighborhood next door, the predominantly white Lower Garden District.
So we're right in a very different places.
This is definitely a tale of two cities.
In these 2 small districts, less than 1.5 square miles, Central City has reported 18 deaths, 16 of them African American, while in the Lower Garden District, only 1 person has died who was white.
We're all in the same storm, but we sure ain't in the same boat. The people on this side have access to what they need to keep themselves safe. The people on that side, they aren't as well equipped.
Banks says many in his district are essential employees, bus drivers and grocery clerks, with limited insurance, sick time, access to health care, and healthy food in their community stores.
You can get a 6-pack of beer, you can get a pack of cigarettes, but you can't buy a head of lettuce or an apple. And that is real.
Experts now say it's more than underlying health conditions like diabetes and obesity. It's socioeconomics.
Whites have very high rates of those same conditions. And the disparities between blacks and whites in these conditions are not big enough to justify or explain the difference in COVID rates.
Banks says COVID has shined a light on a dark reality. Now the next step.
You've got to be able to bring people up. And that way, once you bring the economics up, many of these other problems will start to dissipate.
Looking for health care solutions that don't discriminate. Katie Beck, NBC News, New Orleans.